Do you suffer with headaches, and have you wondered, will a chiropractor help me? Could a chiropractor help me? Is chiropractic care safe, and is it effective? These are common questions that we have seen a lot in our chiropractic clinic. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation, and I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with headaches now for over 20 years. Please remember, these videos are not a substitute for professional medical or chiropractic advice, for diagnosis, or for treatment. They're for informational and educational purposes only. So let's talk about headaches and chiropractic management from kind of a high-level overview. When we start with headaches, you have to realize some of the difficulties in diagnosing them. For the most part, there is nothing objective. There's no test that can be done to prove or disprove the presence of a headache or the absence of a headache. And it's very difficult to find the different triggers that trigger a headache, and sometimes even the causes of the headache. So as doctors, we have to rely on what the patients report to us. And listening to the symptoms, headaches are then classified. So for the most part, a lot of headaches are classified based on what the patient reports. Now, there are some headaches that are sinister, but they're very few and far between. Those would be headaches such as ones that are associated with high blood pressure, or headaches that are from, such as a brain tumor, and those need to be screened out. So any type of headache that you have, when you see a chiropractor, the chiropractor needs to diagnose you. First, they need to screen out anything that's nasty, and then they also need to go through and try and find some painful tissues. And here's the reason why. Most headaches, there is going to be some sort of neck involvement. And if there is a neck involvement that can be found and discovered, oftentimes treatment can alleviate the type of headache that you have. Now, there's a few number of headaches that we'll kind of talk about in these videos. One would be like migraine headaches. Another one would be a neck generated, called a cervicogenic headache, tension type headaches, post-trauma headaches, things like that. So those headaches can respond well to chiropractic care. So what does the chiropractic care usually involve? Well, spinal adjusting, that's where chiropractors put their hands on your joints and adjust the ones that are stiff, painful, and restricted. That is very helpful. Myofascial release, where we're working with hard, tight, tender tissues, such as muscles in and around the neck. That is also very helpful. If there is any weakness that's discovered, going in and doing some core strengthening, core exercises can be helpful. Also, dry needling and or acupuncture can be helpful. Now, those are different. Acupuncture uses points on an energy field called a meridian, or an acupuncture meridian. And these points are predetermined. So based on the headache classification, different points that have been determined and documented in the textbooks, those are the ones that are used. Dry needling is a little different. Similar needles, but you look for tight, tender spots in the tissues. So with dry needling, oftentimes the points are different and vary from individual to individual. Now, once all these tissues are found, treatment plans are usually unique to the headache sufferer. A plan is put together, a trial of treatment is begun, and then we watch and see if these headaches turn the corner. Now, many times, headaches require co-management with medical providers. So it's not uncommon for us to have patients that come in with headaches, and we need to work in conjunction with their neurologist, their primary care provider, doing different forms where they're getting prescribed different forms of medication. All of that needs to be factored in. So you have many videos that you could watch, and I'm honored that you chose this one. I hope that you learned something from this, and until we meet again, have a blessed day.